Hello, I'm Mary Murphy, the Superintendent of the Marlborough Public Schools, and welcome to Episode 5 of Superintendent's Corner. Today we're very pleased. Welcome to the Marlborough Public Schools leadership team. And so I am here joined by my regular co-host, Dr. Skaza.
Hello, everybody.
Yeah, and today we are thrilled that the other part, the missing usual part of our threesome, Assistant Superintendent O'Brien is joining us. So
hi.
Welcome, Jody.
Thank you. Thank you very much.
And we wanted to make sure that the community and the parents met you and knew about all of the multiple roles that you have in the Marlborough Public Schools. So we're thrilled that you're joining us today.
Thank you very much.
Would you start by telling us a little bit about yourself, about when you joined Marlborough Public Schools, and any experiences maybe that you had before you joined us and
Sure.
since? Yeah.
So I've had 31 years of experience in education. Mm-hmm. I started out with certification in elementary education, but ended up with a special education job at a special education school for mostly handicapped students. And from there, I did 22 years at Dudley Charlton as a special education teacher, then a team chair, and 10 years as a special ed director. And then I am now here. This is my 6th year in Marlborough. Absolutely love it. I couldn't have asked for a better district to have moved to after such a long time in Dudley Charlton. I live in Charlton. I have 3 children. Mm-hmm. I have two in college. Well, one just graduated college.
Congratulations.
Thankfully, and one in college and one who's a senior in high school. My other experience has been coached when I was at Shepherd Hill. Did freshman girls basketball, track and field, coached my son's youth lacrosse league. So really, really love doing things with students and getting involved.
I did hear Marlborough High School senior tell you the other day that you were required to wear orange when you're going to
This Friday, Marlborough is playing at Shepherd Hill, who is undefeated. Sorry, guys, but I will be wearing black and orange.
Okay,
and,
all right.
Yes.
So I'm just making sure that you understood that was part of the job.
Yes, go Panthers.
All right. So one of the things that we've been talking about is that at times we understand that we have not effectively communicate all the roles that each of us have in the Marlborough Public Schools. And I think that you started as, what was your official title when you came?
So I started as Director of Student Services. Yeah. Previous to that, it was Executive Director of Special Education. Yeah. And when I came on board, it was Student Services, so it was also, besides special education, was also nursing and counseling. Yep. As well as the Early Childhood Center.
And then since that time?
So that was, so for my first 3 years, and then from there, my roles and responsibilities changed. Now as Assistant Superintendent of Student Services and Equity. So besides special education, besides special education, nursing and counseling, and the preschool, we had also shifted some of the responsibilities from your previous position to for English language learners, as well as McKinney-Vento, homeless, and students in foster care as well. And that just made more sense because those really were student services, and a lot of those different supports are interconnected, and it just made more sense.
Yeah, and I think one of the themes that we'll be talking about today, though, is though you oversee, for example, EL, it's not the same as special ed. It's different, and the EL services come to you, but we all work as a team when we talk about providing services to all of our students in all of our schools.
So part of my job isn't to be an expert in each of those areas. So my role is to be able to support each of those departments and making sure that they're aligned and coordinated, and that they are addressing our strategies for improvement in our district goals. So with that, we do have administrators who have an area of expertise in some of those key key services and supports. One is the director of special education. We have a director of EL, director of early childhood, a supervisor of health services, and previously we had supervisor of counseling services, which is currently unfilled. It's been about 3 years, 3 or 4 years with that unfilled. At the time that I had gotten here, it was really focused on just the counseling with the school adjustment counselors. So we really wanted to be thoughtful about what the district's needs were, and the roles and responsibilities of the previous position were a little bit limited. So we wanted to take that time to be able to see what the district's needs were and develop more of a supervisor of social emotional learning position that encompassed more than what the role had been.
And Dr. Skaza, RJ, for example, one of the things that Jody just talked about was the strategies for improvement. And when we talk about the academics and when we talked about the goals that were focused on that, we also talked about how we're going to measure the curriculum that has to do with SEL. So the two of you overlap in a lot of places?
Yeah, for sure. First and foremost, it's been a pleasure working with you, Jody, and I appreciate you and all that you did to make me feel welcome and get me adjusted to my position in central office. And we quickly recognized what we were going to be partnering up with. So if it's with curriculum or specifically with relation to social emotional learning or professional development and areas that Jody's focused on with her department in professional development and areas that I'm focused in, we're just making sure that we're on top of things and getting what the district needs.
Interesting, because you just brought up the supervisor of counseling and how we've been talking for a number of years, especially during the pandemic, of not knowing what specifics that role should focus on, knowing that we needed someone to be looking at a number of things, but we also recognizing that we didn't want to be unrealistic. It's kind of like we do have a habit of trying to make connections and making sure that things, if we're adding something, that we're making sure that it's thoughtful and it is not a job that is not going to benefit multiple different areas across multiple different buildings and services.
Yes.
Yeah.
Yep.
Yeah.
So I mean, with COVID, especially the last 3 years, obviously lots of districts in the state have been talking about just the increased needs for of mental health needs, and so that has changed. We really are looking to have someone with that expertise to be able to look at what structures we have in place to see if we are utilizing our staff effectively, and if we need to make any changes or improvements. So we have our school adjustment counselors who service special education students, but they also service general education students. We have our director of health and supervisor of health and wellness that is more of a curriculum that's under RJ. He focuses and supervises the health and wellness teachers. And that's part of the social emotional learning, but then we have other aspects that are more school-wide, and what do we need to have in place, and what type of professional development do we need to give our general ed teachers to be able to support the needs of our students.
So when we talk about like the social and emotional realm of the Marlborough Public Schools, we're talking about some staff. For example, we had the school adjustment counselors. We talked to them earlier. And these days, if they're meeting as a department, if they have department-wide issues, they will meet with you at times.
Right.
But you're not a clinical supervisor.
Correct. So
right?
since the time that we haven't had the supervisor counseling, I have tried to periodically
Yeah.
meet with them, but a lot of what they're looking for is someone with a clinical
Yeah.
background to be able to talk about some of their most complicated,
Yeah.
complex cases. And we don't have that person to be able to provide that advice to them and consultation. Different than, say, a special education student
Yeah.
with complex needs. We have John Fletcher, our Director
Yeah.
of Special Education, that the school administration can go to, and he can provide consultation and advice on how to address that student's needs.
And I know that if anyone, the Strategies for Improvement, I believe, is posted on the website. I know that there's multiple references to the SEL and the supervisor of SEL and the need of different roles, data collection, curriculum, those types of things. So I expect that when and if the district is ready to once again try to recruit someone for that unfilled position, that you would be posting out, you'd be working with a number of different stakeholders on what the roles and responsibilities
Yes.
would be.
Yes.
Yeah.
Yep. So particularly the principals need input on, but
Yep.
also the school adjustment counselors, the school psychologists, and also we have some outside agencies
Yep.
that we work with, our wraparound service
Service
coordinators,
yep.
which you had been able to do a segment
Yeah.
on, and everything that they do. So really looking at input from a lot of different people on what are the critical needs for the district for that administrative role.
And everything that we talk about, when we talk about student services, your job is so large that we're talking about all students. Like
Yes.
you're touching all 5,000 students in the Marlborough Public Schools at different times throughout the year.
So especially even with the registration center,
Yeah.
so many families come in with students that have any of those needs, so whether or not special education or homeless or foster or they're in EL. So a lot of times I am providing consultation to the registration center. I'm always looking at data and looking at different ways, like what data have we not looked at to identify barriers for students of marginalized groups, to be able to talk about as an administrative team on how to remove those to make sure that we're having equitable opportunities for all students.
Thank you. And I know that during our next segment, we're going to be talking to a couple of different supervisors. But in the future, we'll also have the opportunity to talk to the director of EL and the
Yes.
assistant director and the director of special education too. So other members of your department, so that the community can meet and hear a little bit
Yeah,
more about what they do
absolutely.
on a daily basis and some of the support they give to students and families throughout the district. Yeah. Anything else?
Sounds good.
No?
Yeah. All right.
Yeah,
Thank you.
thank you.
Thank you. Welcome back. Thank you for continuing to join us. This is the Marlborough Public Schools leadership team. I'm Mary Murphy, and I'm joined by Dr. Skaza and Mrs. O'Brien, the two assistant superintendents of Marlborough Public Schools. And for this segment, they're going to talk to members of their teams and try to explain some of the connections that we all work together for the needs of our teachers and our students in Marlborough Public Schools. Dr. Skaza, do you want to start?
Sure. I've known the individual at the end of the table there for many years now, and been very privileged to work with Mr. Turcotte for this many years. So, Todd, could you tell us a little bit about your current role, how long you've been in Marlborough, and some of the successes that you've had?
Sure. I'm currently a K-12 wellness supervisor for the Health and Wellness Department for the District of Marlborough. I started in the district 21 years ago as a PE teacher with predominantly 8th grade when we had 8th grade at the high school. I spent a few years there. Moved down to the middle school with the 8th graders as they made that move and spent a few years teaching at the middle school. And then 6 years ago, made the leap into the administrative role as wellness supervisor.
Great. Now, you did some coaching along the way,
Yeah.
too, didn't you?
A few years in my early ages, I did lots of sports, all sorts of sports at sub-varsity level, just kind of helping out wherever they needed some extra supports. Enjoy the students.
Great. Well, let's talk a little bit about your current role and what that entails. So, who do you supervise, and kind of what is your realm in this physical education / health world?
Sure. My immediate responsibility is the health and wellness teachers throughout the district. We have 20 teachers at all the buildings combined. I have all evaluation roles over that, and I help them with curriculum building and how they can connect that curriculum to the overall health and wellness of our students.
Great. And when you talk about curriculum and the different levels at the high school, I believe there's a new activity that is involved in the curriculum or the offerings to the high school students. So can you talk to us a little bit about that
Sure.
new program?
And it's not new, but it's revamped and rebuilt and redone. For a few years we didn't have it, and that's our outdoor adventure course.
Dedicated to someone, correct?
Dedicated to one Mr. Kenneth Reynolds, a longtime PE teacher and outdoor adventure teacher at the high school. We just had that finished last year. Dedication was earlier this year. But every one of our students at the high school should go through that program. It's a mix of high and low elements where kids are literally 40 feet in the air with rope tied to them and another student. We're keeping them safe. It's a great team building, problem solving, working together activity that all of our students in the high school go through.
Currently run by who?
Mr. Cormier, Kevin Cormier, who started his career before me as a special education teacher in Marlborough. He's our outdoor adventure course guru, per se, and he does a great job with those students.
The three of us were very lucky to be part of that dedication ceremony, and very impressed by the course itself. And we also had an opportunity to make that part of our leadership retreat this year. Do you want to tell the audience a little bit about that?
That was actually quite special to have, all of the leadership of Marlborough Public Schools come through and partake in our high elements course. We had them up on a zip line, which is 300 feet long, that administrators were able to go through and try. And we had another element where they had to do some crossing of wobbly elements 30 feet in the air. And we had, Howie Priest came out and helped one of our students at Marlborough. We had a couple of PE teachers help out as well. But for the leadership to go through, and that's not normal for them to go out of their, comfort zone and get that high in the air and do that type of stuff. But it was really nice to see, and I think it was an enjoyable experience from the feedback I got.
Great. I just had one more question for you to get started. So there's physical education, and then there's health and wellness. Can you tell us a little bit about the distinction between the two and when health starts in the curriculum?
So our official health curriculum starts in 5th grade. We had it for all the way through 5 through 10. And our 5th graders this year at the elementary are now spending time in health classes once a week. Other than that, the 5th graders are getting 1 PE and 1 health a week. Every K through 4 is getting 2 PE classes a week, so they get to be active, for that hour a week at least. And then we have 6th, 7th, 8th, 9th, and 10th graders all take part in a health class, and 6 through 12 also take part in a PE class. So we're looking to, get kids active on one side, get them moving, get them participating, learning, teamwork, socialization, all that stuff. But we also have them in the classroom where we're learning about nutrition, and we're learning about healthy relationships, and we're learning about human reproduction, and a number of activities.
Right. Well, thanks, Turk. Appreciate
Thank you, buddy.
And to just piggyback on that, there's also a new program at the high school that has come under your department with the foods.
Absolutely. We, again, are revamping or redoing of a cooking program, and that's taught by Miss Sandra Stewart.
Yep.
She came on last year. We developed this program. It actually started when we had Hildreth going on over there at that building. And she's come in, and it's wildly popular. We serve
Very.
all sorts of kids.
Yeah.
What's nice is she's able to take different ethnicities, different backgrounds, and use that background for meals that they're preparing. And one of the things we didn't want was just, let's make cookies and let's bake brownies. And so they're really learning knife skills. They're learning how to cook, how to prepare meals, food safety, all that stuff. It's great.
Thank you.
I was just going to say my sons definitely could have used that class in high school instead of the mac and cheese and the chicken nuggets.
Yeah, you can tell when they're cooking something really tasty because more teachers down in that wing seem to show up. I'm not sure why.
Great. So I'd like to introduce Christine Harrington. She's a new addition to Marlborough Public Schools as our Supervisor of Health Services. Welcome.
Thank you.
So why don't you tell us a little bit about yourself?
So I've been a nurse for 20 years. I started as an emergency room nurse at St. Vincent Hospital, and I worked there 10 years. And in my last year and a half, I was also doing school nursing part-time. So I was working during the day as a school nurse and in the evening and the weekends at the hospital. Wow. And finally, I decided to give one up, and I moved forward as a full-time school nurse, where I worked in an elementary school, grades 3 through 5 in Leicester. And from there, I moved back into middle school because when I did the part-time school nurse position, I was at a middle school, which I really enjoyed. So I wanted to go back to middle school, which is how I ended up at Dudley Charlton as the middle school nurse there. And then last year, I worked in Southbridge for a therapeutic school for students with social and emotional learning needs. And now I'm here as of September, working with all of the district nurses.
Great, thanks. So what had attracted you to coming to Marlborough? Because I know part of this was going from the school nurse position into administrative role. So
I think 7 years now. I actually went to get my master's degree in school nurse education specifically, hoping to move forward as a school nurse leader, to be able to advocate for students and school nurses and make sure that all students were provided, the health and safety within the school district that they needed to keep them safe and healthy. So this position had come up and it was a great opportunity.
Great. And as you've gotten to know the district, what are some of the things in the department that you've really enjoyed or have found to be a strength for the district?
I think that a strength for the district is definitely the nurses that they have who are working in the offices and the buildings here. They're really dedicated. They're a strong group, very knowledgeable. They know how to run an emergency situation. They're very calm and kind to the students, and they all come from a wide variety of nursing specialties, and we can all learn from each other. So I've learned a lot from them already.
Great, great. And how about challenges this year?
So, we're coming post-COVID, and some things weren't priority during COVID, not necessarily in school districts, but just in healthcare altogether. Maybe students weren't able to get that in-person appointment for their physical or their immunizations, and there was a lot of telehealth going on. So we've really been focusing on immunization compliance, which is required for school nurses to follow through with that, where we stay on top of student compliance. Those that are due for immunizations, we're on top of notifying those families and directing them where to go. If they have health insurance, they can go to their doctor, or there's other facilities they can go to. And then, there may be some without insurance, or maybe they have Mass Health and they need a little bit more support. And we work in collaboration in Marlborough with the Marlborough Board of Health, who comes in to help us with the vaccine clinic to keep our students compliant. So
great.
it's been really great because that is really such a luxury in Marlborough, because most school districts, they don't have that opportunity of the Board of Health coming in and doing those clinics for their students and families.
Great. And I know you talked about, what a great department that you have with some fabulous nurses. I think one of the other challenges that you've been facing, which we've been facing for a couple of years now, is still have a couple of vacancies there, don't we? So want to talk about where those vacancies are and what attracted you to be a school nurse as an RN versus working in a hospital?
We definitely are short-staffed, and we do have open positions, one being a full-time position at the Marlborough High School, and we also have a full-time district-wide nurse position that's available as well. And then we have substitute positions that are open, and we've been working really hard on interviewing and hiring. So we have two hired. One is in the process, and we have another interview coming up for another substitute. So we're kind of building that substitute pool for the school nurses. And I do see, in the future, I do think we will fill those two open positions. Sometimes it just takes time, and people looking for that right fit too. Some want to do school nursing, but maybe they only, they're looking for elementary, or maybe it is the high school they want. So it's really dependent on what they're looking for. But the reason I became a school nurse, so it's kind of funny. So I've always had that, emergency. I always wanted to go back. I never got the fill. I tried different departments in the hospital, which I enjoyed and I learned from, but it wasn't enough. I always wanted to go back. And when I started school nursing, people don't realize how busy you are in a school in the things you do. We're taking care of students with diabetes, students with seizure disorders. I have had several students over the years with rare disorders that there's not a lot of information on, and that leads me doing all the research to learn whatever I can to give them the best care possible. So, and then you have your emergencies on top of it. Not daily emergencies, but we have some that some people don't realize. I've had to give EpiPens. I've had to give emergency diastat for a student with a seizure. Things like that.
So there's a lot of variety.
There's a lot of variety. It keeps you on your toes. It's always something different, but you never know what you're going to get. And I like that piece. So, and you get to work with these kids in your community, and you get to know them. And personally, as a nurse and a mom, I'm into sports. I like to see what the kids are involved with. I like to build those relationships with the students. And that way, too, they have another trusted adult. And a lot of them do really, they confide in the nurse in a lot of things. But then they don't realize, too, when they're all in the waiting room having their conversations, how much we hear, too. So it's just fun. It's a great job.
Great. Thank you.
So one of the reasons why we wanted Christine and Todd here was because there are incidences when you two work together. And one of those is the Student Wellness Advisory Committee. And that's just one example of how multiple departments in the school department all get together and focus on one outcome, right? And generally it's, that's student wellness, right? So can the two of you, we know that with COVID, we haven't had a lot of activity with the Student Wellness Advisory Council. But pre-COVID, we had community members, we had students, we had parents involved. So do you want to talk a little bit about beginning that process again?
Sure. Like you said, we had, pre-COVID, we had a pretty good SWAC, Student Wellness Advisory Council. And we had 3 or 4 students that were recruited, that we recruited them as freshmen. They stayed on with us through their senior year. We had a couple of parents. We had some community doctors and dentists that joined us. And due to COVID, that kind of, limited people allowed into the building and limited people to get together. So Christina and I are working to rebuild that, to get some student involvement again, get some parental involvement. We are meeting later this month to get that process rolling again. It's always nice to have people from the community that you may not ever hear from that come in and see, you can get their perspective of what's going on and what they feel that students need. Because sometimes we can't see everything, so it's nice to have that extra set of eyes or opinions sometimes.
Todd, we didn't mention it earlier when we were talking to you, but you were also one of a number of Marlborough Public School employees that are involved in the Marlborough Alliance for Prevention Committee as well. So working with that larger group to bring programs and awareness to our students and the community. So thank you for that.
That's a nice program. Kathy Leonard does a really good job with that. If you've driven by either the middle school or the high school, you've seen the flags out. We had the 1,800 flags for the opioid awareness for everybody that has passed for opioid abuse in the previous years. And they do things at open houses, bring in events for parents to participate in during open houses at our buildings. And it's a really nice, again, chance to get out and be part of the community that we don't always get in the buildings.
Yep. So thank you.
I think at the building level, the PE health teachers do a lot of work with the nurses within their buildings too, with some of the curriculum that that you cover. Do you want to talk about any of that? Like, don't they collaborate with?
We do share a lot of responsibilities. The PE department at the high school helps out with mandated screenings for scoliosis. Do so at the middle school with that. We do, lots of times the hearing screening, the eye screening goes through, we coordinate with teachers of the wellness department to help out the nurses. We can't do it all. We can't ask them to do it all. They'd be overwhelmed. So if the wellness department gets to help out there, that's something we've done in the past. And obviously with us being outside, where, the bee stings and the EpiPens, as Christina mentioned earlier, we have that connection as well that some teachers just may not have, but we do work closely together in some things.
And earlier we were talking to Jody about the social and emotional needs of our students. And Todd, I know that we've talked in the past about how there is a core curriculum in the elementary programs that generally the homeroom teachers are all trained in and do in their classrooms, but the wellness staff supports that in the elementary. And then it kind of, those topics transition more to the health classes when you get to the secondary levels.
So the elementary schools right now, the homeroom teachers, the core education teachers are doing the second step bullying program. And that's something that the wellness department at the elementaries has been involved with. And what we're doing is we're trying to get involved by using some of the same language that core elementary teachers are using in their classrooms and making that something that is not just a one-time event for those K through 5 students. They're actually hearing that language, hearing those ideas again in wellness class whenever viable or available. And then, as you said, as you mentioned, when we get into that 6 through 10 health class, there's much more emphasis on that emotional health that goes on in the health classroom. focus on bullying, focus on relationships, and how to be in a healthy relationship, whether it's at a friend level or at a dating level later on in life, whatever. But lots of emotional help, where to find help is one of the things that some of our students just don't know. So we have that as an option and availability to students.
Thank you.
Great. Well, we're very grateful that you both joined us today, and very fortunate
Yeah.
to have you both on our team. So thank you.
Thank you.
Thanks for having us.
Thank you. Thank you for joining this episode of the Superintendent's Corner. Hope to see you again next month. Thank you.